Three things I would never do as a brain doctor and a pain doctor. Number one, I would never let a chiropractor crack my neck. So let me tell you why. If this is your cervical spine, you have a couple of blood vessels that are very important in the neck. One of them is called the vertebral artery, right, which you can see in red right here. And the other one, not displayed on this model, but a bit in front of it, is called the carotid. And you've probably heard of that one too. But basically, those are the two main sources of blood supply coming from the heart all the way to your brain. Now, what happens with chiropractic neck manipulation, specifically a type called HVLA, high velocity, low amplitude, is basically that they are cracking your neck in such a way that unfortunately is putting these vessels at risk. So what can happen is that you can end up with a dissection. So that's essentially a tear inside the vessel wall of the vertebral or the carotid, and that will essentially compromise the blood flow to your brain and lead to a stroke. And there's definitely reports of that happening after chiropractic manipulation. I have seen two cases in my residency where basically young patients had a stroke and it was associated with a chiropractic neck manipulation before that. And again, I mean, not all manipulations are created equally, right? So physical therapy would be safer, massages, acupuncture, all that would be safer as well. But when it comes to cracking, so all those videos that you see on TikTok and Instagram with those cracking sounds that are happening, and similarly with some of the traction maneuvers, I would stay away from those. Because they can compromise your blood vessels in the neck, like I said. They can also compromise your spinal cord itself and potentially lead to spinal cord compression or worsening of nerve root compression, radiculopathy, and just not worth the risk. So I would not do that. All right, let's move on. The second thing that I would never do is deadlifting. Now, I love going to the gym and working out, but there are definitely safer exercises to do than deadlifts. Traditional deadlifts, unfortunately, put you at a risk for injury to your lower lumbar spine. Now, what can happen, especially with any kind of flexion to the spine, but especially with the deadlifting maneuvers, is basically that you'd be putting so much pressure on the disc and the vertebral body that you'd be at risk for disc herniation worsening. So that disc potentially can herniate even more when you're doing that. If you already have a disc herniation, or if not, or even if you don't have a previous disc herniation, essentially what can happen is you can lead to a tear in the disc, and then ultimately you can have a disc herniation that will compress the nerves and shut down your legs, or even lead to more serious injuries. So I have seen too many patients over the years who basically were referred to me because they had a new onset of back pain or sciatica shutting down the legs, and they didn't have any other risk factors aside from deadlifting at the gym the day prior, let's say, or the day of the injury. So again, risk and benefit ratio, there's definitely safer exercises that you can do, like squats and other exercises that potentially would be safer than doing the deadlifts. So I personally do not deadlift at all. And I think a lot of it has to do with technique, right? So you could argue that if you're deadlifting with the right technique and not a massive weight, then potentially it can be safer. And that's true, right? But if you're not doing it properly and you're using a massive weight, then potentially you'd be putting yourself at risk. All right, and then the last thing that I would never do is basically I would never rely on an MRI to dictate my treatment plan, whether it comes to the brain or the spine. So for example, if you have low back pain and MRI shows a bunch of disc herniations and facet arthropathy and nerve root impingement, I wouldn't really rely on the MRI to decide on what the best treatment plan is. Because a lot of times the MRI doesn't necessarily correlate with the symptoms and with the actual pain generator. So there's a lot of studies that show that asymptomatic individuals who don't even have back pain, 60% of those people are going to have disc changes and arthritis and a lot of degeneration on their MRI, but that they're not in pain, so that doesn't really mean anything. And then same and vice versa, right? So you can have minimal problems on your MRI, but then be in excruciating pain. So I would never rely on an MRI to dictate what I'm going to do about my back and potentially other body parts too.